Hi, hello, good morning. Hello and welcome of this webinar, this information by email, by Skype, sorry, excuse me, this by YouTube connection, sorry, this information about the Instituto Bernabeu. Let me introduce myself. My name is Jordi Suñol, gynecologist in medicine, reproductive medicine. In the next few minutes, we will talk about the situation of the couples of women trying to achieve a pregnancy at the 40s. Around 39, 38, 42, this range of the age. We try to explain what's the situation, how we can help these couples in the project to achieve a pregnancy, and after that we'll be open the discussion with your questions, and I will try to perform the answers in the best as I can. Well, in our society, the couples and the patients try to delay the project to achieve a pregnancy later than the biological conditions recommends. The right time, the better way, the safer procedure to try to achieve a pregnancy is in the young age, on the 20-something, on the 32, 33 years old. After 35, 36 years, the quality of the eggs is declining by the time, and that produces less number and also less quality of these eggs. That gives the possibility to achieve obtain a spontaneous pregnancy number and also less quality of these eggs. That gives the possibility to achieve obtain a spontaneous pregnancy is lower and lower, and the time is not the expected time to go ahead with the information about the quality and the functionality of the reproductive potential of these couples don't help if this is delayed on the time. The first point, the important point, is that when you try to achieve a pregnancy under 38, 39 years old, it's strongly recommended do not delay to contact the medical care with the specialist in reproductive medicine in order to have the full picture of information about what happened and how we can help you in the best way as possible. It's very important to have the complete information of the medical antecedents for both partners or for the patient, if this is a project of the single patient trying to achieve a pregnancy or of the lesbian couples. In this case, it's important to know what is the healthy state of the situation of these patients by means of the medical visit, and try to have all the full information about that. In the second step, it's possible to obtain a very, very useful information about the ovarian reserve situation by means of the blood samples and the measure of the anti-Mullerian hormones and the scan controls and the ecography in order to check the number of the small follicles in the ovaries, which is the antral follicle count. Both methods, it gives the information about the potential regarding the number of the eggs we could obtain in case we perform the ovarian stimulation treatment. Ovarian stimulation treatment is the medical treatment in order to induce the recruitment of the eggs and the oocytes in the ovaries by means of medical therapy. And the patients are later than 39, 40 years old is strongly recommended to perform the personalization of the right strategy in terms of the medication and in terms also of the daily dose of these drugs in order to induce the normal and the best as possible in terms of the number, the recruitment of the follicles and the eggs. These markers, anti-Mullerian hormones and the antral follicle count by means of scan control, that gives information about the number, but unfortunately we are not able, we don't have any kind of possibility to check the quality of these eggs before to start the cycle. The only thing we could do is to try to obtain the maximum of the numbers of the eggs, and at the laboratory, this is the first time we have the possibility to confirm the good quality of these eggs, and also the potential of these eggs to be fertilized by the sperm of the male partner of the sperm from the bank, for example. And this early stage of the embryos that produces a very useful information about the potential of these mature eggs to produce evolutive embryo and finally obtain a blastocyst on the day 5 in order to select the best morphological embryo to be transferred. In this context, in particular context of the 40 years old, we gestational diagnostic test. This is the pre-gestational test that gives the possibility to perform the biopsy of each of these embryos in order to confirm not only for the morphological quality but also for the genetical good balance of that. That gives the possibility to select the right embryos. We have really potential to achieve a pregnancy that should reduce the risk of the spontaneous miscarriages or abortions, and that gives the best chances and the safer procedure to help these couples to have a healthy child at home. Another factor related with the quality of the eggs is not only for the genetical charge, it's also for the energy on the ovarian, the battery, some kind of the reserve of energy, and these eggs are able to produce the cell divisions on the right way in order to obtain the good quality embryos. Unfortunately, we can change the genetical charge of these eggs, we can't change the possibility of the energy of the reserve of these eggs. In this case, the only thing we could do, and this is important because that gives a completely different with the possibility to achieve a pregnancy in the best conditions or not, is the study of these embryos by means of the gestational study. It's important before to start the procedure to share with the couple all the steps of this information. The recommendation of the IVF procedure as the most efficient way to achieve a healthy embryos and help in the efficient way to achieve a pregnancy, and also the evolution of what happens during the ovarian stimulation, the ovarian responses. As you know, we select the best morphological embryo and the best conditions, and that gives a very, very useful complementary information on what happens in each particular case of the different patients. This kind of the procedure of the IVF with information provided gives the possibility to share with the couple the concerns or try to help for the next steps of the decisions. The quality of the eggs is not only related with the age of the chronological age of the patient. In fact, it's not related at all. And we have young patients of the 20-something or 31, 32 years old. I should have the very, very low ovarian reserve, not related with the chronological age. And this is an important concept to try to make the difference between the young patient with poor ovarian responses, ovarian reserve, and the patients around the 40 to 42, 43 years old. In this case, the quality of the eggs seems to be related with the chronological age of the patient, not of the chronological conditions by means the anti-Mullerian hormone, the functional conditions by means we could check by means the anti-Mullerian hormones. In this situation, young patients identified as a poor responses have the good potential to achieve a pregnancy, even if the number of the eggs is very low. And the patient with more than 45 years old probably have the very, very low possibility to achieve a pregnancy. This is the reason we prefer to, before to start the procedure, try to personalize information for each couple and try to share with the couple what could be the most efficient way. In some countries in Europe, there is not allowed to perform this kind, the genetical study of the embryos, and it's possible to repeat again and again and again the different IVF rounds without the possibility to select the right embryos. That could spend time, illusions, and a lot of money trying to achieve a pregnancy with a not really efficient way to identify the right the right embryos. Okay. This is the initial information about the procedure, and the message is that do not delay the first consultation with the medical specialist. The second one, try to obtain, by means of the confidence with the doctors, full information about the situation before to start the procedure. We are able to design a personalized strategy for each couple in order to obtain the best conditions as possible. And the results obtained during the procedure of IVF is the excellent and very precious complementary information in order to decide the next steps of the strategy. Because in some cases, and not related with the age, it's possible to obtain less good conditions than we expected at the beginning, and the opposite is true. And some patients, we think their possibilities are really, really low. In fact, at the time of the brain stimulation, we could be surprised by the number and also the quality of these embryos. We need to try to have the full information about the potential of these patients. Okay. This is about the quality, genetical quality, the energy quality. Now we will open the consultation and share with you the questions on the chat. We are ready to perform the answer. Let me check that, please. Okay. I am 41. I have been trying to get pregnant for 6 months. Should I wait much longer before going to see a specialist in case of need help? How much margin? Well, this is a 41 years old patient trying to achieve a pregnancy with a short period of time, 6 months. The question is it necessary to wait longer in order to expect or to confirm the spontaneous pregnancy? In my perception, and as usual, we recommend, and also is the same advice of the reproductive societies around the world, after 39, 40 years old, it's strongly recommended to check the conditions and to check the situation and don't expect to have the spontaneous pregnancies. That is done by means of a very simple medical consultation. We have all full information about the medical antecedents and the previous treatments or the previous surgical interventions, etc., etc. And this is important to personalize the next steps of the procedure. At the 40 years old, 41 years old, we strongly recommend to check the anti-Mullerian hormone by means of blood exam of this patient and try to have the information about the scan control of the ovaries to check the number of the antral follicle count. Both methods should predict the possibility and what happens in the real conditions if we try to perform IVF procedure. Short answer, we strongly recommend to try book an appointment and go ahead with the procedure as soon as possible without any kind of emergency. But we are not agreed to wait and see for the next steps of that. We need to perform the positive implementation of the chances to achieve a pregnancy. It's my perception. Okay, we have the content, and these are requiring for information about the possibility to achieve the next procedure of that. In fact, we are putting the focus in the age of the patient, but it's very, very important not to forget the other factors involved with the potential to achieve a pregnancy. This is not only the quality of the eggs, the important things are the different factors involved on the success or failure of the procedure. This is strongly recommended to check also the male partner to confirm and everything it's okay about the quality of the sperm, normal, the number, motility, the volume of the sperma, of the ejaculate and the spermatozoa, and try to confirm that everything is okay. And also, it's important to confirm the lack of the anatomical problems, for example, fibroids, polyps, or cysts in the ovaries, etc. Before to start the project, the pregnancy, it's strongly recommended to check the general status of the health of the patients in order to avoid the problems during the pregnancy. Okay, there is some couples that have had the problems in order to finish the treatment as going on before the interruption of the coronavirus. In these patients, this is not related with the object of this communication today, but now we are ready to start the activity in order to continue all these treatments and also to start the next treatment in the very, very, very short period. We are working now of start all the procedure activity on the labs and the medical consultation and go ahead with the treatment as soon as possible. Okay. I am so sorry, but the delay of the beginning of this appointment today, we have had little problems of the connection for the previous one. This is the reason of this starting session. It's delayed for a few minutes. I am sorry about that. This is another question about if that have sense to preserve the eggs and the oocytes at the 40 years old. This is the direct question. And the best profile of the efficiency and the best results that we should obtain about the procedure of the cryopreservation of the eggs in order to delay the project to achieve a pregnancy in the next few years after the thawing process of these frozen eggs. We prefer, if it is possible, to perform this freezing in the patients with 35, 37 years old. After 39, 40s, the efficiency of that could be a little bit lower. In this case, another problem is the number. It is possible, in particular case, we want to go ahead with this project to perform the successive of the different ovarian stimulation in order to perform the additions of the eggs collected of the first round and to try to perform in addition eggs obtained on the second or third round. The number of the eggs obtained that should be estimated or that should be predicted in more or less accuracy by means the anti-Mullerian hormones, and that gives information on what could be the right strategy and the right daily doses in order to improve the number of the eggs to be frozen. But in fact, it's important to preserve the eggs in the good conditions and the good quality and expect to have the good evolution after the thawing process. After the thawing process of these frozen eggs, we expect they have the high possibility to be fertilized, and fingers crossed for the evolution of these fertilized eggs. The results is better in the younger patients. There is not, it's possible to perform this cryopreservation in the patients even at the 40s, but we prefer to be really honest and share the different possibilities of these couples. Different possibilities that could be to fertilize these eggs by the sperm and the frozen, the embryos for the delayed embryo transfer. It's one of the possibilities that we should share with the patients. Teams are not able to help these couples to achieve a pregnancy. In this case, or in case we try to perform one IVF round and the result is not really good, we are not able to produce healthy embryos to be transferred. In this case, have the different possibilities, and each couple or not to try to move with the different procedures in order to achieve a healthy pregnancy and a healthy child at home. Some of these treatments are allowed, and another treatment is not possible to perform this kind of procedure. the message. What I think is important to share with you is that in case we go ahead with IVF procedures, we strongly recommend the procedures before the embryo transfer is done in order to select the really potential embryos to achieve a pregnancy. And also, it is not possible this kind of a procedure in the different countries. It is not acceptable to repeat again and again and again for these procedures, because if you are not able to identify which are the good quality embryos or not, it is not logical to recommend this kind of the treatment. And in the same way, in other countries, it's not possible to move for the different chances to achieve a healthy child at home. But this is a different subject of the decisions we need to share with the patients. Okay, that seems to be the questions. In case of you have further questions, please don't hesitate to contact us by means on our website and the contact email address, in order to be able to help you in this topic and the other, also different topics that are exposed by the colleagues in the next few weeks. So we're talking about the different factors involved with healthy gynecological care of the patients. Now, if you have some doubts or some complementary questions, please don't hesitate to ask us about that. Okay. Now, in the next few minutes, I will perform the interruption of the activity, only 5 minutes, 3 minutes, and I will start with the Italian version of this information from today, if you agree. Okay? Thank you very much for your presence. Bye-bye.